I'm Colin Martin and I'm a medical physicist from NHS Greater Glasgow. I want to describe a survey that I've undertaken together with colleagues in the International Atomic Energy Agency of practices around the world. Next slide. This survey tried to obtain information on the performance tests and patient dose surveys and also the sort of regulatory requirements relating to these in different countries around the world. And versions were prepared in Portuguese to obtain information from Brazil and Thai for Thailand. Next slide. The aim of the survey was to obtain viewpoints of medical physicists of the practices that occurred. So it's not a comprehensive survey. Now, in the United States, the medical physicists that we sent the questionnaire to were unable to give an overall idea, and they suggested it was better that we contacted the regulatory authorities. So the information from the United States is based on a slightly different group. Next slide. This summarizes the countries from the different continents that were involved. And so we had 49 countries and obtained 137 replies from these various countries. Next slide. The first image shows the mandatory requirements in the regulations. So the first bar shows whether performance tests on X-ray equipment were required. The next bar shows whether patient dose surveys were required. And you see the European countries, particularly Western Europe, have a much greater mandatory requirement for all of these aspects. And this because of we've had the legislation in place now for over 20 years. Other parts of the world, most have some requirement for performance tests on X-ray equipment, little on requirement for patient dose surveys, and some for the use of that information in optimizing practices. Next slide. Performance tests on X-ray equipment, we divide into three types. The first group show tests performed before the equipment was put into clinical use. The next, routine surveys, and the last, optimization, the performance of tests by the user. And you see that, again, Western Europe and the majority of countries require tests before equipment goes into clinical use, but America, both North and South, appears to be slightly different in a lower level of requirement for those tests. Next slide. The groups that perform the tests we found varied across the globe. Medical physicists were certainly the major group involved, and there were differences between different countries. Some, the medical physicists were hospital-based, others, they were private medical physicists. Next slide. And in other parts of the world, such as Africa and Asia, the government personnel played a significant role in the tests of all the X-ray equipment. Next slide. So, summarizing the patterns, in Western Europe, it's very much the hospital-based medical physicist who leads on the tests. In the USA, Eastern Europe, and New Zealand, it's more the private medical physicist. In Eastern Europe, the university personnel play quite a significant role. In Asia and Africa, government personnel tended to be the ones who perform most of the tests. And in the services in Thailand tended to be radiographer-led. Next slide. We then looked at the performance of patient dose surveys in the different countries. And again, Western Europe in particular carries out a much greater proportion of surveys, whereas across the rest of the world, the number of surveys performed, even though these are CT scanners with comparatively high doses, the number of surveys performed was relatively low. Next slide. We next looked at diagnostic reference levels, because in order to utilize the patient dose information, there needs to be some sort of comparator to assess how appropriate the dose levels are. So the majority, this is something that has been pushed by Europe. And next slide shows that the majority of countries in Europe do have diagnostic reference levels in place. In fact, all of the Western European countries do for both adult and pediatric CT, whereas the use of diagnostic reference levels, even for CT across the rest of the world, is fairly sparse. Next slide. We then looked at how the different countries utilize the information from the performance tests, the patient dose surveys, and the DRLs in the process of optimization. Again, Western Europe used all three of these, whereas many other parts of the world utilize the performance tests, but not the patient dose surveys or diagnostic reference levels. Brazil was something of an exception. They performed more patient dose surveys, but on fairly limited numbers of patients, whereas in Europe, between 10 and 30 patients were used. Often in Brazil, this was less than 5 in an individual survey. Next slide. So the patterns across the different countries show that in Western Europe, it's the physicists based in the hospitals who are involved, and they're closely involved in the optimization process. In the USA, Eastern Europe, and New Zealand, it's more the private medical physicist who is involved. They need to have close links with the other staff if they're going to carry forward the optimization process. In Africa and Asia, it was government personnel. In Eastern Europe, the university personnel had quite a close involvement. And in Thailand, the service was radiographer-led. Next slide. So the requirements for successful optimization are really to have good physics scientific support, but also linked in closely with those performing the examination and carrying out tests on the equipment. Next slide. So to summarize the different models, hospital medical physicists can carry out the surveys, the tests, and link in closely with the radiographers performing the examination and are successful in optimization. Private medical physicists can perform the same role, but need to have that close link with those in the hospital. University personnel may be involved in patient dose surveys in some countries, and it's important that the results from the surveys themselves are linked back to the users and used in optimization. Government personnel can perform a similar role, and this can be successful, and the radiographers can take up the role as they have done in Thailand, and here they are getting more training in physics so that they have the scientific background to take the optimization process forward. Next slide. In conclusion, there are a number of models that can be used to take this forward. An important aspect of the success of all of these is the familiarity of the individuals involved, both with the tests carried out and their involvement in the optimization process. And there is a need to establish close links between all the individuals involved. Thank you.